Welcome to SDHC's Health and Wellbeing podcast. Before we begin, we want to emphasise that the information shared in this podcast is for educational and informational purposes only. While we strive to provide accurate and up-to-date content, it is not a substitute for professional medical advice, diagnosis or treatment. Always seek the guidance of your doctor or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Remember, your health and well-being are invaluable, so prioritise consulting with a medical professional for your personalised care. Hi everybody, you're listening to the Health and Wellbeing podcast from South Downs Health and Care with your host, Dr. Nick Harvey. The purpose of this show is to help people understand how they can help themselves and others with their health and well-being. Every episode, I interview an expert to understand the latest evidence and advice on how to improve your own health or help the health of others. This month, I welcome Stephen Clarke to discuss mental health and physical activity. Welcome.
Thank you very much for having me.
Stephen's completed his degree and an MSc in Brighton University over 25 years ago, alongside his wife. He's been an avid user of the centre's facilities ever since. Stephen's a coach at Team Bodyworks, a performance triathlon club founded by Glenn Cook, a Team GB Olympic coaching staff member, and Sarah Coop, a Triathlon England South East Region Academy head coach. The club's produced numerous world and European champions and caters to a wide range from age 4 to 62 years old, supporting both able-bodied and disabled athletes at all levels. His wife recently launched a successful swim school section within the club, addressing the demand for quality swim instruction in the Eastbourne area. Before his coaching career, Stephen worked as a clinical exercise therapist at South West London and St George's Mental Health NHS Trust for over 15 years. He founded Exercise Professionals for Mental Health to promote physical activity in mental health care, collaborating with numerous trusts, NHS England, Public Health England, Mind and Rethink to develop and implement effective exercise guidelines for mental health service users. Stephen continues to maintain clinical involvement through private personal training clients and with various comorbidities and challenges. Additionally, he serves as a senior coach at Eastbourne Rugby Club and works as a casual lifeguard at the Mead Centre. He is deeply passionate about his work and remains committed to enhancing community health and sporting opportunities through his diverse roles and expertise. Blimey, Stephen, that's a hell of a lot. And I think, what you've been up to speak volumes about how, committed and passionate you must be. I say this every time, but it's genuinely inspiring and exhausting in equal measure to hear what you do and things. And I guess what jumps to mind, and again, I say this every time about how, juggling all of this, especially with people who have challenging problems, how do you manage to keep a level head yourself and give a bit of time to yourself and your family and amongst all of that?
Firstly, thanks very much for having me today. It's an honour to be on here. So, yeah, I think I do seem to cram a lot in. It does sound like that. And definitely juggling, I think, for most people nowadays is the same for everyone. But when you're doing something that you're passionate about and that you enjoy doing, I think it comes a lot easier. So yeah, at the moment we've got two young children. So going from coaching in the morning, handing over the children, doing the school runs, coming back, getting on with your other bits of work through the day, back to school runs, then back to coaching in the evening. It can be very, very busy and sometimes it does take its toll a bit. But then I think it's about making sure that you give time to those things that are really important. So giving a bit of time to your family, making sure you've got that time set. A bit of time for yourself, which is probably the one area that I sometimes don't do as much. I've tried a lot harder this year. But again, as I go back to it, it sounds like it's a lot of things, but it's a lot of things that I enjoy doing. So it's enjoyable and happy to do. So it doesn't feel like a burden or a chore. Something you want to go and do every day.
Fantastic. So yeah, if you, I love that old adage, if you enjoy your work, you never work in many ways. But it strikes me listening to you, you've actually got quite a routine that maybe helps you as well. Is that right? It sounds like, you've got the school that things work around and there's quite a routine almost every day that helps you achieve that. Is that fair?
Yeah, I think so. And yeah, if we didn't have that routine, I think it would actually be a lot harder. So yeah, we're very, very set. Like I say, my wife coaches and teaches as well. So we have to switch over maybe sometimes from session to session at a pool. And so sometimes it's handing over the children in between. But we seem to have got it down to a fairly good routine at the moment. You wouldn't believe that when you see it in the house beforehand, trying to get the children out, but it does seem to work. But yeah, having that routine of the children have to come first to get them to school, making sure that they're looked after as that they need to be. And then we can work the other things around it. Then you've got your athletes that you're looking after on top of that, and the sessions that you run. But yeah, somehow it all comes together.
I'm intrigued about how, because you mentioned earlier, and I thought there's a slight cue there that you weren't attending to your own needs and maybe your relationship needs too. I wonder from that busy schedule. So what difference have you made this year then that made you a bit more positive about that? Then I'm interested in that.
It's actually probably more down to my wife. Christmas, you got to have some more time for yourself to do your own exercise, because it was kind of coaching constantly, doing other things for people, and not actually doing the exercise myself as much as I used to.
Mm-hmm.
So she kind of gave me a nudge and gave me a month's gym membership. It was like, kind of get the hint, go and do something. And she was right. I got back into it. Like you preach this all the time to other people and you support people to do it. Sometimes you kind of neglect yourself. But since getting back into that, so I'm doing a bit more swimming, and that I used to love doing, a bit more running. So yeah, it's just giving myself that time during the week to have my own space and same for exercise. No, I definitely feel better for it. And I think relates back to or shows in the work that I do as well, because you've given yourself that opportunity, do your own thing, you feel better about yourself, and then you have more energy to give to others. It's
funny though, isn't it? When you aren't doing it, it feels like a very difficult thing to get back into again, isn't it? And when you're doing it, you kind of think, well, why wasn't I?
Yeah.
I'm fascinated there though, because you've just kind of shown how your wife kind of held you to account there, and we all need that, don't we? And I
definitely.
guess that's a bit of a segue into what you do, I suppose.
Yeah, no, definitely. Yeah, having someone that you're sort of accountable to or with, we should always be accountable to ourselves as well. But working with someone, not necessarily working with your wife, you're helping each other, but working or helping someone definitely gives you that extra motivation to get things done. And then, like you said, once you're back into that routine, you find again the enjoyment in it and what it brings to you, and you enjoy that process of developing and improving and seeing what changes you're making to yourself and how you're feeling. But for a lot of people, and like I say, for myself at the beginning of this year, it was that needed that sort of help to get that going. But yeah, working alongside someone, so whether it's an athlete and a coach relationship, husband and wife, friend and friend, having someone that you're working with is very beneficial.
Thanks for sharing that, because I think there's a lot of us that are a bit proud to kind of not almost want to admit to ourselves, let alone other people, that it does take someone else to kind of help us out of there, isn't there? And there's a phrase I learned recently, toxic masculinity, and I've got a bit of that, because you think, I should be able to do this myself, and it almost creates this negative thing when someone else is trying to help you and hold you to account. So thanks for showing our listeners that even people like yourselves, elite coaches, have the same problem.
Yeah, I think it goes for anyone. And if we want to improve ourselves, you have to be open to taking help from and support from other people. No one knows everything. No one gets everything right. So it's good to learn from everyone, and having that support really helps.
Yeah. So thanks for letting me gape into your personal life a little bit. Just before delving into the topic of today, I was keen to then just understand what the challenges of your job are. Now, I say job, you got more than one job, and so answer it how you will. But it strikes me that some of your jobs that you've had in the past and even now must be pretty challenging. And I'd like to understand, what the challenges are, how you cope with that, and what you love about it.
Yeah, I think as I've said, I've been very lucky with the jobs that I've done, that they've been enjoyable, and I've loved actually doing it. So it makes it a lot easier to do. I think previously, when I was working at South West London St George's, a lot of the challenges were more around trying to instill our role within the service, coming in and doing exercise and physical activity with patients was often seen as, oh, you guys are here to do the fun stuff, which, yeah, it's great. It's fun. But there is actually a lot of benefit to what we're doing as well. So trying to show the clinical side of exercise therapy was a real challenge, to challenge the culture of the service, which did take quite a long time, but definitely by the time I left, and there's a great team there doing some great work, we'd managed to really change things around within the trust. I think we were holding fun runs, which staff and patients were joining in, a football team that had been established, and there was much more buy-in and people talking with you involved with the MDT. So, and then that goes further onto NHS, and I guess we'll talk about that a little bit later as well with the exercise professionals for mental health. But there is no guidance or anything to say that exercise needs to be implemented within mental health services. It's just a good thing. So not every trust provides that. So it's trying to change that. So that was probably the main challenge. That challenges within the patient population is the same as everyone trying to find their motivation. How do you get people to engage in physical activity and exercise? But that was also the great bit. You get to work with someone when they're potentially at their lowest and support them through. And you have very, very challenging times, especially when someone's very, very unwell and maybe on an intensive care unit. It can be very hard work. But then once you see them come through and back into the community, and you bump into them into the community and they thank you for doing that and tell you that they're still going to the gym or still going swimming, it's great to hear, and that change has been made. So I think the challenges are normally around systems. That's my challenge. Working with people is great. I love whether it's something hard you're working with, for that person to change a routine, change a habit. So with the athletes, some of them will find their training hard at times. I'm feeling tired, I'm feeling hard, but actually, okay, how do we look at this? It's going to be hard. You're going to be tired when you're training, but how do you help your recovery? How do you see that influencing your performance in the future? How can we adjust things? How's your sleep? How's your nutrition? And it's a whole package that you're looking at. But again, like I say, the challenges bring the enjoyment to it at the same time, because that's something you want to really get involved and dig into.
Yeah, thank you. I'm struck by what you said about culture as well, because you're absolutely right. It's made me reflect a little bit while you're talking on primary care. So we've got funding for a whole host of kind of allied health professionals, one of whom can now be health coaches. And there hasn't sort of locally certainly been the kind of uptake I thought there might. And of course, I think it's cultural, isn't it? And it actually takes time, doesn't it? Yeah. And a lot of patience and skill to kind of get through that, so that the system then can work for the patient, because it's not just about the individual who's delivering it, it's about the system around them, isn't it?
Yeah, absolutely. It's culture. It takes a while to change, but it's possible if you've got the passion and want to get there.
Mm-hmm. So we're kind of talking, I guess you're talking to the converted, so I'm just aware that we're two fairly active people chatting about getting other people more active, but why the hell should people bother being active? Why is it better than on our side of the fence? Why should we bother getting up in the morning and doing that job?
It's a question I get asked a few times when I was working in hospital and with some of my personal clients that I see now. But I think evidence-wise, if you look at that now, there's so much evidence out there now about how physical activity and exercise can improve our physical and mental health, with all sorts of conditions that can be improved by just getting yourself active. And that could be in very different ways, whatever suits you to get active. But it can improve our mood, releases good chemicals within our system to give us more energy. It can help our self-esteem greatly just by doing a short bit of exercise. It can improve our sleep. Once you've done some physical activity, your body's more tired, so you can get your sleep, which is really important for recovery, for installing things that you've learned through the day. So you need your sleep. So doing the exercise during the day, we know that exercise can improve cardiovascular health, decrease the risk of obesity, diabetes. But again, if you're trying to talk to someone that doesn't enjoy that or doesn't understand that those things aren't often what you want to hear. But I think the biggest thing is it can be really enjoyable, depending on what you like doing. If it's getting outside and doing some gardening, whether it's going for a walk in nature, whether it's swimming, a structured exercise program, whether it's doing something online, doing something with your children, but it's enjoyable. But there's no getting away from the evidence that physical activity is hugely beneficial for both your mental and physical health.
It's interesting, that you reflect on the enjoyment part, because you're not going to do it sustainably, are you, if you don't enjoy it? And I've thought more and more recently about, especially when having teenage children, that we seek a lot of kind of hits, dopamine hits, don't we? And so dopamine's that kind of pleasure chemical in our brains that is released when we do something we enjoy in the moment. So, you get that from social media, don't you? So and lots of things, eating and nice foods that taste nice, that is not necessarily good for our bodies. Same with social media, binge watching telly. So all of these things that give us a pleasure that aren't good for us. Whereas exercise is that same hit if you can get there, and yet it's so good for us, isn't it? I'm keen to rattle off some stats for the listeners. I mean, what amazed me when I looked into it is that, look, let's just remember, first of all, in East Sussex anyway, the top causes of death are dementia, heart attacks and strokes. All of those can be reduced by being more, reduced happening in the first place by doing more exercise. So if we take dementia, which surprises some people, probably 30% of people with dementia either wouldn't have it or wouldn't be as bad if they had been more active in their life. If we take heart disease, 35% probably wouldn't happen if they'd been more active. So all causes of death, 30%, like nearly a third of people wouldn't have died from what they died from if they'd been more active. And just to expand on it, you said the diabetes, so that's 40%. Colon cancer is 40% too. Breast cancer, 20%. And then way up at nearly 70%, hip fractures. So people who fractured their hip. This is often ends up happening in the last year of their life, fracturing a hip, and that could be avoided if they had been more active throughout their life. So this is something that has an impact way down the line, isn't it? Can't speak kind of highly enough. And then the other thing about the statistics, so just to zoom out a little bit, 1 in 6 deaths are due to inactivity, we think. And 1 in 2 women, 1 in 3 men, 4 out of 5 adolescents are probably inactive. So do you mind just expanding on what we mean by inactive? Because, of course, there's a whole spectrum, isn't there? So what scientifically are we meaning to come up with those stats?
Yeah, so when we're looking at getting the adequate amount of physical activity, and we're looking at 30 minutes of moderate intensity exercise 5 times a week, which means getting out, doing something that you're getting slightly out of breath. It doesn't have to be full out. We can do higher intensities, but getting out, getting yourself moving, getting slightly out of breath, doing that regularly 5 times a week, 30 minutes is the guidance, or high intensity exercise we can do for a slightly shorter period of time because you get the same similar effect.
It's as simple as that.
Yeah.
Isn't it? It's as simple as that. And I think, and you can split it out, can't you? So if you build it into your day, you make sure you walk a really brisk walk into work for 10 minutes at lunchtime at the end of the day, and it's done, isn't it? If it's going to be that.
Yeah, break it down into 10-minute segments. Could be anything, like doing the school run. If you're anything like me, you're quite late going to school, it's quite a brisk walk. So breaking it down into those sections, anything can help. But it's again, try and get yourself into a routine of when you're going to do that and where you're going to fit it into your days. People are busy, whether it's work, families, whatever lifestyles they've got. It's busy times, but like coming back to me earlier, it's about important to make time for yourself, especially when you look at those stats and saying this is what's going to happen later in life. It's not necessarily going to show now for your younger populations, but those you're kind of developing those foundations for that to potentially happen if you're not being active. So if you can start preventing that when you're a bit younger, you've got a much better opportunity going forwards. Likewise, when you are getting older, it doesn't mean that you can't start then. That's still going to help and have preventative measures, and could also still reduce the risk of those, whatever age you are. I very luckily work with an elder lady, 82, and she's only really taken up the exercise in the last few years because she wanted to try and improve her health for her cardiac health. And so any age can get started.
And what strikes me as well is that this is better, like people respond to it better than anything I can do. So if I look at medications and I want to start, say, a statin, a medication for lowering someone's cholesterol, I've probably got to treat, it depends on the person, obviously, but I've probably got to treat somewhere between 20 and 30 people with a statin in order to prevent one heart attack. And if and we've already heard the stats with activity, I suppose with my intervention and yours, we also know though that if we support 8 people to get more active, by the end of that year, at least one of those will still be active. So it's hugely better than any drug we've got. It's usually better than me even investing time and telling someone to stop smoking, because that's even harder to do. So people can do it, can't they? And then the other thing we touched on was being overweight and other risk factors like high blood pressure. So why focus on activity if someone's thinking, oh, well, I could lower my blood pressure, I've got medications to do that to lower my risk, or I could lose some weight? Why choose activity?
I think all the associated things that go with physical activity. So you'll be helping yourself lose weight, and you'll be helping yourself reduce your heart rate without the side effects of any medications that you're potentially taking to do that. So it's a much more natural way to do it. We spoke earlier about the release of chemicals when you do physical activity. So you're going to be improving your self-esteem, improving your energy, improving your mood, whilst also treating those potential cardiovascular issues, reducing your lipids. But quite often, and this isn't to say anything against medication because it's very much needed, quite often there's side effects with those medications which are going to have a knock-on effect with something else. So if you can do exercise and do physical activity and build it into your routine, that then also becomes a lifestyle that you can take rather than wanting or having to take medication for a long period of time, which isn't always beneficial and might not have an effect after a certain amount of time, whereas exercise will always be able to continue having a positive effect for you if we're doing it correctly and safely.
And I couldn't agree more in terms of the medication. Of course, if anyone takes a medication for high blood pressure, you mustn't stop it, and you need to stop it at the right time, with support from a medical professional. But I couldn't agree more that this is a better way of dealing with it if you can. I think the other thing just to highlight here is in terms of leading risk factors that we can do something about for people dying, inactivity is firmly in at number 4. So it's a more likely risk factor than even being overweight, isn't it? And it can also influence the risk factors that are higher than that, like high blood pressure, like diabetes. And I'd argue even smoking, because smoking, while it is a bigger risk factor for death than inactivity, I think people who are exercising and have their other dopamine release system are probably more likely to be able to quit smoking. So I think that impacts all of them pretty heavily. And then the last thing, I'm getting my agenda out here a little bit, aren't I? So apologies. But the last thing I wanted to preach about is the costs to our society in terms of the benefits and things of our health intervention. So as a doctor, I'm totally a part of this, and that's why I'm trying to explore how we as a system can support people in terms of prevention better. So here it is. In 1948, the NHS was born. In that year, they spent 11.4 billion pounds in today's money for healthcare. At that time, life expectancy was around 67 years. So it had improved without the NHS from 41 years life expectancy to 67 because of things like sanitation and things like that. Then with the advent of the NHS, the life expectancy did creep up, but it's crept up very gradually. It flattened out that curve, and now our life expectancy is about 85, and it doesn't look like that's going to increase. But our spending has gone from £11.4 billion to £153 billion a year. But, those are comparable figures in today's money. So we're spending more and more and more and seeing less for it. We've got less, happy people, more illness, and no greater life expectancy. So we really need to think about how we prevent. And in my mind, I'm the converted activity is where it's at. So how do we help people? I want to move on though, because you've got some real expertise around depression and mental health, haven't you? And of course you set up the exercise professionals for mental health. So tell me what inspired you to do that and a bit more around that. So let's focus our time on that.
Yeah. Funny enough, I actually went into working in mental health completely by accident. I did my master's at University in Sports Science and then got a temping role within the hospital and then was offered a full-time role and then ended up staying there for 15 and a half years, which I loved. And so that's working with a whole spectrum of mental health conditions. So whether that's depression, anxiety, through to psychosis, schizophrenia, eating disorders, drug, alcohol detox. So you're working across a whole spectrum and with children, adolescents, adults, elderly population. So you've got to work with a whole spectrum of people at different stages of their illness and episodes. So I think just quickly touching back on your statistics, what's really shocking for me is a stat that always, you mentioned the life expectancy, is actually the people that suffering from severe mental illness, so schizophrenia or bipolar, on average die 15 to 20 years younger than the general population, which is an absolute scandal. It shouldn't happen. And there's 2 in 3 of those deaths are from physical illnesses that could be prevented from improved physical health. It's not necessarily to do with their mental health. So when we're looking at that, and why aren't we as a nation making these opportunities more available? So we keep talking about physical activity, but nutrition as well, and just that whole sort of healthier lifestyle. So whilst I was working in my role, we provided exercise opportunities, we did screening, motivational interviewing, and behaviour change, how to get people active. Because sometimes people come in when they're very, very depressed and don't want to do anything. They're just in their bed. I can't do anything today at all. So sometimes you don't want someone going in there and going, come on, we're going to the gym. This is really good for you. That's not going to help anyone. So it's about finding what's achievable for them. And it might be someone that's just laying in their bed to start with, is actually, let's have a sit up and a chat, and getting someone to sit up initially and then gradually having those sort of achievable goals. So lots and lots of challenges about how you work with people, but there's people out there with the expertise to do that. And with the exercise professionals for mental health, like I said earlier, there's no guidance saying exercise or physical activity needs to be provided within hospital settings for mental health. Some trusts do, some trusts don't, and to varying degrees. So myself and my colleagues, we really wanted to try and change this. And within our trust, we started to do that by trying to implement that within individual services to make sure that we were involved in care planning, involved the MDT. And then we tried to take that further, went out to a few conferences. And so we decided, let's set up Exercise Professionals Mental Health. We want to develop guidelines of what trusts should be providing, and then what those exercise professionals should be providing, what qualifications, what standards they should be working towards, so that everyone's getting really good quality, effective care. Because it's everyone's role to get someone active. Absolutely everyone's. Healthcare assistants are frontline because they're on the wards all the time, so they're great for getting people active. Come, let's go and have a walk around the garden or whatever it is, or go and play something. Nurses, doctors, whoever it is, that's everyone's role. The qualified exercise professional comes in with that more structured support, and especially working with the physical health conditions associated with mental health. So we want to set those guidelines up, which we were working towards, and managed to get that set up for a forensic service, medium and high secure. So that was, again, really multidisciplinary, different services. So Public Health England were involved, Mind, service users heavily involved, because they're the ones that need to be telling us what they want and need at that time. Mm. So we managed to get some guidance set up for forensic services from how when someone's admitted to being discharged, what that pathway looks like. When do they get offered these interventions, or what can they be offered straight away? How do you get someone exercising? As I said, if you get someone in and they're already active, why stop them from doing something that they enjoy doing, where they're making things harder for ourselves to get things going again? So we looked at a whole pathway around exercise, nutrition, pharmacological interventions, and that formed a really great package, and it was rolled out, and then COVID hit, and then everything took a bit of a back burner on that. And then at the same time, I left the trust to come into my new role with Bodywax. But things were starting to change, and you can see some great work that services have done. We spoke about obesity levels, and again, there's a much higher prevalence of obesity within people suffering from mental illness. So again, a scary one for young people suffering from severe mental illness. They're 3 times more likely to be obese than general population at that same age. And whether that's down to lifestyles, medications, a combination of both, but some medications have been shown that we can keep the weight gain off that some medications induce. If you keep that weight gain off over the first 6 months or 12 weeks, we can then keep that off over a longer period of time. But for that to happen, you need the exercise professional in that initial consultation and care planning stage to make sure that those things are in place, and that the patient knows what the risks are with those medications, and actually, look, we can control this, but we need to do this and this and this. And funnily enough, on the whole, people are very keen to do that. So we set that up, and by the end we had members around the country and some abroad, held a couple of very good conferences and shared practice days, and which, like I say, after COVID, it's had to take a bit of a back burner with restructuring of how things worked, but definitely something we need to get back up. We're still doing some work with Mind and Rethink, who are doing some great work of how do you transition people from hospital into the community, because that was always a big problem for us. It was, we've done all this work, we've got you here, but we can't give you support going out anymore because just the staffing that we had. So quite often you've been in hospital and you go out into community, it's scary anyway, let alone trying to go to find a sports venue by yourself. So it was definitely more of a passion thing to get that up and going and try and get exercise recognised and utilised properly within mental health services.
And what amazing job you did. And I hope that anyone listening with influence can hear that, this really needs to be well funded, doesn't it? You've highlighted while you're talking some, significant inequalities, not only between people with mental health and who don't. We need to remember that people with mental health problems are also more likely to come from low income backgrounds, other disabilities, be from other, ethnic minority groups, and whether they have a mental health problem or not, those groups also are much less likely to be active, much less likely to live as long. And the only real way often at the moment to get more active is to pay for it, isn't it? And we need to really fight to get more resource so we can get to the people who are going to benefit most, don't we?
Yeah, absolutely. Yeah, it can be very expensive to try and find things. There are some great things out there. Again, going back to mine, they've got some information on their website of local groups that do things, but that's not going to appeal to everyone. So it's making sure those opportunities are available to everyone. And that's why you have to work with patients and the public to find out, actually, what would you want? It's great. I could come here and go, let's set this up. That's not necessarily what people want to do. So it's finding out what's going to engage the most people. And then how do you then engage those that are left out of that? Because they're just as important.
Absolutely.
So whether it's through individual programs but yeah, it definitely needs more funding to have those sort of exercise professionals or in place in primary care. I think, like you said, having them available to do brief interventions with people within a service in the surgery, or having it linked so that the yourselves as GPs can say, right, maybe have a chat with this person. That's the starting point. They'll then hopefully have more time to actually sit down and go through what is the importance for you. What do you enjoy? What have you enjoyed in the past? What have you never tried, thought you might want to?
Just a kind of have the counter argument there, because I know my colleagues might be wincing in the sense that the trouble is that we don't have physical space. We firefighting in terms of the level of demand of ill health. And so I totally agree, but also just kind of want to bring into perspective that there's long-term benefits from what we're talking about that kind of aren't realized throughout the systems that we have, because we're kind of forced to focus on the here and now demands, which is the wrong way around, isn't it? I want to, if that's all right, move the conversation a little bit along, because I'm keen to understand a bit more about exercise and mental health. Are there any specific types of exercise that are particularly beneficial for people with mental health problems?
No, to be honest, it's the same as anyone. It's something, if you enjoy it, it's going to be more beneficial. There are some strong evidence that's been coming out over the past few years about strength training, weightlifting, particularly, has had very good effects. But if you're doing physical activity that you're enjoying, you're more likely to continue it, which means you're changing your lifestyle rather than just making an acute change. So you're changing your lifestyles, finding what you want to do. But then with the enjoyment, that can be really hard to get that started. So if exercise can be done individually or in groups. So it's finding out what you like doing. Ideally, if you can and you like it, getting outside, getting in nature and doing that exercise, getting some natural light, getting away from phones and social media that we spoke about, and just getting natural light and oxygen makes a huge difference. People will probably listen and go, but I don't like being in groups. People that live in built up areas that don't have access to parks, and where we are so lucky here, having the downs and the seafront and the fields around us. If they're living in built up areas, they might not want to go out. It might not be, they don't feel safe, but there's ways that you can have individual programs indoors. If you've got children, like my little ones, they love there's some dance active things on YouTube and yoga things. And so I join in with that, which they're often better than me because they're more flexible. But there's different ways of exercising for everyone. But depending on you as an individual, what you like doing, whether you want something a bit quieter, yoga, Pilates, something more mobility, or whether you want to go and get involved in a sport. But yeah, definitely the enjoyment bit, there does seem to be a lot of research coming out about the improvements that strength and weightlifting can make.
And then once people are exercising a bit more, what strategies do you use to help people stay motivated and consistent with their routines?
I think that's important to do right from the beginning, is have that conversation around what are your motivations, what are your goals? And that doesn't have to be specifically a fitness or exercise goal. Quite often it comes back to I'd really like to be able to play more with my children, or I'd just like to be able to go for a walk with my friends without getting out of breath. It can be those things which are much more meaningful. So it's finding a meaningful goal that you want to aspire to try and get to. Now, that might not be a really easy quick fix. So what we've then got to do is look at how do we break that down. Let's use like the Couch to 5K is such a great initiative. It's a really good example as well. So you might say, sorry, going back to more of a sports specific one, I want to run 5K, but you don't do anything at the moment. You're sitting down all day, have done for a long time. So it's not reasonable to say to someone, yeah, okay, we'll do that next week. That's fine. But if we break it down into, okay, how are we going to achieve that? This week, let's start by going out for a walk and then gradually build it up and have achievable and realistic goals that person can get to. The hardest thing is having a goal that's so far out there that you can get put off very quickly. So it needs to be brought back, and you work through those processes. And whilst you're doing those smaller goals towards your main goal, sorry, it's a lot of goals there. That's when you hopefully start to learn to enjoy the process of what you're doing. You start to learn that actually I enjoy this feeling. I enjoy being out. I enjoy whatever your exercise it is that you're doing. And you realize actually it's making me feel better. I feel healthier. I'm meeting some people doing this. And you get those processes and wins as you work towards your goal. And then that's when you start creating habits that you can continue for a longer period of time.
So create achievable goals, include other people in it.
Yeah.
I suppose.
And make it meaningful.
Yeah. Fantastic. Thank you. And does nutrition play much of a role in this as well?
Yeah, and I'm not a trained nutritionist or dietitian, but did some of my degrees and very luckily worked with some very good dietitians over the years. Yeah, again, it's very coming back to general population of want to try and get away from those processed foods and refined sugars, which again can be much easier said than done if you're used to having those foods. But those foods, we can often feel sluggish afterwards. And that sluggish feeling is then within your body as well. So trying to move away from that into, and the one that's always advocated is Mediterranean diet. If we can move more to that, where it's a bit fresher, self-prepared, which again is for a lot of people, once they start doing it, it's enjoyment of preparing your own food. Some people will say, oh no, it's too busy to do that. Which is fair enough, but maybe start with once a week. I'm going to make something from scratch and see what that's like. But getting those fresher foods, the nutrients that you'll get from that are much better, and you feel a lot more energized from having that. But not just nutrition, your hydration. Hydration is so important, which I think people underestimate massively, especially now the weather's getting warmer. Making sure that we are drinking water or flavored water potentially, but trying to get away from ones with sugar in. And definitely sort of caffeine drinks aren't going to overly help you with your hydration. But I'm not here saying everyone's got to stop coffee and things like that. But make sure you're having your water through the day. It's like a race car. If you went and put diesel into a Formula One car, it's not going to go as well. If you're putting good quality fuel in it, it's like putting water into you. Your body's made up of water. That's what we want to get back in our systems. So just make sure you're putting in, what you put in is the good stuff. That's what you're going to get out.
So some of the barriers we touched on, and you were saying earlier, like good sleep, good food, fuel, good hydration. Any other barriers that kind of face people to exercise and getting the most out of it?
I think not knowing where or how to start, being nervous and anxious about starting some sort of exercise routine. It's really powerful how much that puts people off. Working with people, so often you hear when you say, oh, we need to do some resistance exercise or some strength work, and people are like, oh no, I don't want to get all muscly and big. Vice versa, you say to someone, like, we need to make sure that there's some cardio type stuff in there as well, but that's going to be much better for your cardiovascular system. Oh no, because I want to stay muscly. And people have a perception that you can only do one or the other sometimes, whereas they can work hand in hand, depending how you do it. So, and people, when you talk to them about exercise initially, I think a lot of people will think gym, lots of people. It doesn't have to be a gym. It can be outside by yourself. It can be outside in pairs. You can find groups to do things in. Swimming in the sea. Again, we're very lucky here, open water swimming. But trying to sort of, what's the word, demystify that thought of what exercise is. Yeah. It doesn't have to be structured exercise, any physical activity, gardening, going out for a walk on the downs with your dogs, with your children. We've already said doing things with your children is often quite active. But supporting people through that initial phase is a big thing. And like we said, I think one of the easiest things to put people off is when you don't have those achievable goals. So again, making the realistic goals is really important. If you're not seeing results, why are you going to carry on? So yeah, I think just that, making sure you're goal setting well and supporting people to find something that they would like to do. And that could be something that I used to really enjoy. I used to really enjoy dancing when I was younger. Okay, let's go and find, definitely not my area of expertise, dancing, but we can find somewhere that can do that. Or I've never tried this, but I would like to. Cool. Let's go and
use that. So sitting in my seat as a healthcare professional, how could I and other healthcare professionals better support our patients in integrating physical activity into their kind of day, their plans?
Yeah, that's a huge question. I think it's a hard one because everyone is so busy and so stretched with what they're doing. But I think if possible, to give that small bit of time to explore with people, what are they doing physical activity wise? As you said earlier, it might have someone coming in that's seemingly fairly healthy and they're a bit younger, but if they're not doing physical activity then they're potentially putting themselves at risk as they get older if they haven't got that in their lifestyles already. So having an early intervention strategy when you see people, and whether that's, again, probably not possible for GPs to do, but having a link with an exercise professional or healthcare worker that's got time to sit with someone and talk through that. And for a GP, it could be something as simple as, would you be interested in physical activity can really help your health? Would you be interested in talking to someone about this? But as a bigger thing, for me, especially working sort of secondary care in hospitals, it's how we get exercise and physical activity embedded in those systems and how we can support people going into the community. That's a huge task. Yeah. And it might mean that we've got to work closer with charities that provide things within the community. In the past, I've going back to Mind again, but they have a lot of opportunities that you go and work with. Football clubs, rugby clubs nowadays have health programs, and you get people in. I know Rugby League are doing some great work with men's mental health, and they do a set of sessions of 40 minutes long. They call it halves. We're going to have a half of this where they have a discussion about healthcare, and then they do 40 minutes of exercise, and so they have a match. So it's, again, there's ways to be doing it, but having physical activity embedded into sort of someone's care plan routinely and just addressed routinely, I think can make a big difference. But I do appreciate how busy. Yeah,
although I think it's not an unreasonable challenge that we think about activity like we do asking about smoking or drinking, isn't it? It's as simple as that, isn't it?
Yeah.
If we ask more about it and more aware of it, then we can make the next steps. And if we don't, we won't.
Yeah.
Yeah. Thank you. So, but ironically, given what we're talking about, I've been sitting down for far too long talking to you. So, and hopefully the listeners aren't too bored of our ramblings. I wanted to move us on then to a question from a previous guest, the wonderful Katie Day. So, she said, no surprise given her specialist interest, I guess, there's so much information about the importance of physical activity. However, it's different for each person in terms of gender, age, and previous experience. I have read that high-level physical activity for peri- and postmenopausal women is detrimental rather than beneficial. what would you suggest is the correct level of activity for women experiencing this life stage?
Thank you. That's a tough question. No, a really good question. And I'll be completely honest, it's definitely not my area of expertise and wouldn't have the exact answer. But what my initial thoughts would be, again, as with anyone, working with the individual. It's very important to work with the individual to find out, again, what they're used to doing, how active are they normally. And if that person is very active, then maybe higher intensity exercise is what they want and what they're able to do. But there might be times when that isn't appropriate. And what you could do is, at that initial sort of consultation stage, is say, okay, when you're in your hardest moments, what is the minimum thing that you think you could achieve that day? And encouraging them to just do that, that's fine. As long as you're getting something done, we're not then overdoing it. Again, I would suggest some strength training is probably important at that point with the hormone changes to support our joints, especially, and some load bearing work to try and prevent onset of osteopenia and osteoporosis. But again, being completely honest, I would, if that came to me as a client, I would go away and find out much more information before I actually did an intervention with them.
Yeah, I mean, I would be frightened as a GP to almost ever discourage physical activity. The benefits in most people far outweigh the negatives, but it's about listening to your body, isn't it? And so we can't give one size fits all advice. I think, like you, I'd be concerned in somebody, especially who's peri or postmenopausal, doing lots of exercise and not getting enough calories, because that they'll thin their bones even more. I'd be worried about them suddenly doing more exercise, like you said, because you'll get joint or muscle problems because your heart gets fitter quicker than your body gets stronger. So it's about pacing it, isn't it, and listening to your body. But I agree with you. I don't think there's a blanket reason why we should be telling anybody to exercise less, but to listen to that intensity and how aggressive it is. I think we'll wrap it up there. Thank you very much. It's been fascinating for me to hear of your experience and your wisdom, and I think there's some lucky people in Eastbourne to have you as a resource. I think there's other resources about. So is it okay if we get you to share those with us so we can put on our website so any listeners can connect to you or to your resources that you recommend?
Yeah, I'll give you emails, and there's some recommendations for books and other people to look at if you've got an interest in that mental health and physical health and physical exercise. So you definitely have copies of that.
Thanks very much.
Thank you. Thanks for having me.
You've been listening to the Health and Wellbeing podcast on the connection between mental health and physical activity with Stephen Clarke and me, Dr. Nick Harvey. For more information and resources, check out our website sdhc.org.uk. If you have any feedback or suggestions for future episodes, please email us at sdhc.feedback@nhs.net. Tune in to our next episode where we'll be interviewing Kate Blythen on deprescribing in frailty. Please take a moment to subscribe to help support us in supporting others with their health and well-being.